Hello, everyone, and welcome to webinar 2 of Building Self-Advocacy in Healthcare and Communicating Effectively. It is great that you are joining us in your lunch break, very likely, as we learn about giving some tools to advocate and build your voice in the health system. I'd just like to acknowledge the lands in which we are all meeting here today. I am coming to you from Quandamooka country, and I would like to pay my respects to any elders past, present, future, and emerging, and acknowledge that they have walked and cared for the land and respect their continuing culture and the contributions that they make to the life and to this country. I'd also like to acknowledge anyone here with a lived experience or significant others who walk along this journey, or trek is what I refer to it as, with them. And also acknowledge that the many leaders, tribes, people, organisations, and advocates who have spoken about the issues that we're going to discuss here today and the topics, and they have done so for decades. The work we are doing and the work that we are able to do really builds on their legacy. We stand on their shoulders, and because of their dedication and advocacy, this work that had preceded us means that we can be here today. So let's get into it. I would like to just mention, who is Qendo? Who are we? We are Australia's only free service and support provider that is a national service and support provider for people affected by endometriosis, pelvic pain, adeno, PCOS, and infertility. And we have done this since 1988. We offer free national services that include 7-day helpline, mentor programs, our free Qendo Care nurse navigation program, webinars, and things like our Qendo app. And we work in partnership with funders and organisations to ensure that local communities receive information that is culturally safe, health literate, and is evidence-based. Our goal is to ensure people have access to care regardless of their postcode. And we have people joining us here from all walks of life, but also all different areas within Australia. So welcome to all of you. So we also would like to thank Brisbane South PHN for supporting this program, which has enabled us to deliver these webinars. So Brisbane South PHN works in partnerships with health professionals and communities to improve health outcomes for everyone in the region. And as an outcome from this program is we have just launched our health literacy webpage. So you can go to qendo.org.au/health literacy and see a range of different resources, including the webinars that we are presenting here. They will be filmed, and this is being recorded, and we will upload that onto the website here. You'll also find guides and tools and resources and downloads and connection to so many other programs that will help you to build your voice in the healthcare system. We do have these resources in 9 other languages, so you will be able to find your language and look to some culturally appropriate resources that is there for you. Our workshop 1 is already up on this program website here, so you can look back to understanding your rights and options in the healthcare system and talk through we spoke about all the different types of systems in healthcare and talked through how to get the most out of it from that stage. But what we're here to talk about today is a little bit more in depth, and I'd like to first of all get to know you. This will also help you. I'm just checking that people can see me. If you can see me, this is a great opportunity. If you can, please, in the Q&A, there will be an option there down the bottom of your screen. There should be a Q&A where you can pop in some questions. But if you could just let me know if you can see my camera, please, that would be good so that I can do that. And can you also see the slides? Can you see the slides as well? Please, if you can comment, yes, we can see the slides. That would be wonderful. Great, you can see me, thank you. And can you see the slides? Thank you so much. Great. Okay, they're all popping through. So now that I know that you have the Q&A working, Please can you let me know who are you? What are you here to do? Drop a light bulb if you're here to support someone going through endo, chronic pain, pelvic pain. Drop a heart or a handshake if you're a partner, friend, manager, or loved one who's walking along this trek with someone with endo, pelvic pain, I don't know, PCOS, infertility. Drop a headphones symbol if you're here to listen and learn with empathy. Drop a rainbow if you're showing up to make your workplace, home, or relationship safer for this conversation. And drop a speech bubble if you're a part of the support crew. This will help um, us to understand who's here in the room. And if you can pop those in the Q&A, whatever emoji you are here as, that would be wonderful. Headphones can't add emojis. Okay, no problem. We're still learning webinar system. So if you can tell us who you are and what you're here for. If you can pop in an emoji, yes, that would be great. No emojis in Q&A window. Thanks, Gerda. Let us know in terms of typing out. What does that look like? Okay. So what are we going to cover? I want to really give you some tools today to prepare for appointments, what to bring, what to ask, how to get to that stage, how to build the team. Language tools about talking about chronic pain or ongoing pain, advocating for second opinions, advocating for that continuity of care and follow-ups, and some culturally and linguistic tools for those with English as a second language. So we want to talk through that. Now, the Q&A chat is there for you. If you have questions, Ash and Nicole are online and are able to respond to them. And also we will be collating a list of resources that you can pop in. Now, Ash, if you can also work out if we can enable the chat window while we're live on webinar, that would be great. It may require us to, or not able to, because it's live. So anyway, Ash will work on that in the background, but we have our team here. If you do need support, please just comment in the Q&A and we will reach out. Now, as I'm talking, it's always a bit interesting to refer or talk over a webinar. So if something hits home, please drop a heart or type heart in the Q&A chat. I want to know from you, is this resonating? This helps me know what's landing. Sometimes when you're presenting a webinar, you're just talking to yourself, it feels like. So I really want to know and get to know what's working for you, and also helps other people to realize that they're not alone, and a reminder that they're not alone. So if, something hits home, drop a heart. If you're taking notes and if there's something that you're absorbing and learning, put a little writing emoji or type in there that you're taking notes. And if something clicks, or if you feel seen, or if it feels really helpful, please also drop a heart or let us know in the Q&A. Like I said, this is a huge topic, so it helps me to know, do I go deeper into what we are sharing here, or at what level do I keep the information? So I need your participation. Yes, it's a webinar, but your participation will help a lot. In webinars, you usually sit there and absorb information, as opposed to a workshop. But I really would like your participation and partnership in helping you better understand these information as well. Okay, so every year we at Qendo provide a national Raise Your Voice survey. And this is available on our website currently, and Ash will pop in a link very soon where you can go and share your experience and share what is important to you. Now, this is important to us because it tells us as an organisation what to advocate for. It tells us what are the issues that you are facing. And it means that we can provide these to policymakers, we can provide these to researchers, and we can tell them this is what the community is facing. What solutions could we put forward to help alleviate some of these barriers or some of these issues? Now, this is an overview of the 2024 survey. We're always reviewing them, and we will look to do that towards the end of this year for 2025. But in 2024, these were the top issues identified in Australia today. If any of these resonate with you, please let me know. So early diagnosis and symptom recognition was a huge issue for people. Education for medical professionals was identified as a top issue. So people noting that people with who are health professionals don't actually know about these conditions. People were struggling with comprehensive treatment and management, so they felt very fragmented in the system. They didn't understand how to get that team approach. They felt like they didn't have support. Patients or clients or consumers, whatever we want to call ourselves, we felt like we didn't have support. We didn't know where to go. Yes, we might have sat in that GP's office or sat with some sort of health professional, but we weren't sure on those next steps. So support for patients was a big one. And then access to specialists and treatment options. Often I'm sure we all know, and please pop in the chat. I can see that's working now, which is wonderful. And thank you so much, Ash, for pulling that together. So the webinar chat is our function is there. And so please feel free to comment, ask questions, etc. in that chat there. And contribute. Yeah, access to specialists. So it may not only be a gynecologist, but it may be also a thoracic surgeon if you are concerned about endo in the lungs or the thoracic cavity, or it might be access to a gastroenterologist. Some people are telling us here that a language barrier was a big issue when they arrived to Australia to help find support for symptoms as well, and would be really keen to learn more about that for that participant here who has shared that today. Thank you for sharing. And we also saw some significant statistics. This really rocked me. I live with endometriosis, and really supporting all of the many people that we are here talking with every single day, and I've done this for 12 years. That these really shocked me. 82% of people were unable to attend work due to endo in the last year. So 82% of people, and we had thousands of people complete this survey, 82 weren't able to attend work. 85 people weren't able to attend social functions due to the symptoms that they were experiencing. 92% of people reported endo had impacts on their mental health. 93 reported that their ability to exercise was impacted. 86 reported their eating habits were impacted, and 89% of people said that it affected their ability to manage day to day. So that's just normal day-to-day activities that they were impacted. And someone had said that treatment is not just surgery and then it's done. We know that we need ongoing support without having to beg for help. So those numbers are not decreasing, so we still have some work to do. But that's okay, that's what we're here to do. So I would encourage you, and Ash will pop in the chat or the Q&A, and as well a resource after this session, to share your voice into this survey. We share this with policymakers. We share this to advocate for new Medicare item numbers, new PBS item numbers, and with the wider community. And a lot of people reference this because we want to ensure that your voices are driving policy, are driving change, and are enabling that advocacy in the healthcare system, so that at the end of the day, when we as patients sit in front of that GP or in front of that health professional, we know that we've contributed and we're seeing that quality and outcome of our life impacted positively. That's the cycle we're trying to influence. People also told us that these were the top or most reported symptoms in relation to endo, pelvic or period pain. People experiencing fatigue, migraines, low iron, and bloating. And people also told us that these were the most common symptoms. So management symptoms. So people found movement and physical exercise activity exceptional to manage their symptoms. We know motion is lotion. With our bodies, it often doesn't feel like what we want to move, but moving really does help our body and our nervous system and our pain, which are really on fire when we are finding symptoms of endo and pelvic pain. We all love our heat pack, so heat is huge. Pelvic physiotherapy eating or diet modifications, stress management, analgesics, IUD, which is the Mirena, opioids, medicinal cannabis is one that's increasing, and people are finding incredible outcomes from that. There's really good studies going on at the moment. So we'll see that one, I think, grow. Voltaren suppositories, which I call pretty much a Valium for your butt. If you want a really good sleep, good 14 hours of pelvic pain relief, Voltaren suppositories are great. You can get them over the counter, a really good option for you. Speak to your GP about that one or your pharmacist. And also the combined progesterone only oral contraceptive pill was the other one. Okay. So, how do we start to advocate for ourselves in the healthcare system, and what do we feel? And sometimes we often feel like we just can't do it, and we just don't really even know where to start. And what I would like to introduce you to is something called the self-determination theory. This is a piece of research that has been done only recently that talks about what do people need in order to make decisions in their healthcare journey or their healthcare trek, which is what I refer it to. We're not going on a P&O cruise. It can feel like a trek. So the self-determination theory requires three things. It requires autonomy. So feeling of being the origin of one's own behaviors. And that looks like agency, having confidence, having some energy behind making some of those decisions. The second element was competence, feeling effective, which is really confidence. So having confidence that you know that you're making the right decision. And I am sure we have all experienced some stage of our life walking out of some sort of interaction with the healthcare system, feeling a complete knock in confidence, feeling as though we perhaps have been gaslit. There has possibly been medical misogyny. There is feeling like we just don't know why we're here, the point of why we even attended this or presented or anything like that, and we just need help, but we're not getting the help that we need. And that can really knock our confidence. And the third element, which I love, is relatedness. So feeling understood and cared by others. And that is where community comes in. Everything we do at Quendo is stem and built upon this self-determination theory. We want to build your agency. We want to build your ability to understand your emotions, your symptoms, your feelings, your diseases, and then being able to take the next step. We want to give you confidence. We want you to feel confident in yourself that yes, you may not have a medical degree, you may have a medical degree, you may have a health professional background, you may be incredibly intelligent in your area, but have no idea about healthcare. That doesn't matter. Throw all that idea in the bin. We want to still give you confidence, regardless of your background, to advocate for yourself, to ask the right questions so that you can build your agency, you can build your confidence and power and energy to get what you need out of your interactions. And then we want to connect you with community. We want to connect you back in with a group of people who get it, where you don't need to explain yourself, where you can come along with a heat pack, feeling crummy and just be held in a space where you don't need to explain yourself. But be paired with people who have been there and who have learned that journey with you. And so that is a huge thing as a part of this, and that's why we love these three pillars. So you can connect in with a local community. You can go to our website, quendo.org.au/find your community. You can find your local group. We have incredible leads that are out there wanting to connect with as many people as possible. We can connect you with a mentor that they'll walk alongside you, where you can share and speak with someone every week for 6 weeks. We have our Quendo nurse where you can access and speak with someone and they will hold space for you. Our wonderful nurse, Jill, will chat with you with where you're at, where you're heading, and what's next for you, and connect you in with people. So that is what we're based on here, and all of our programs and services are linked from that. So, personalized decision making, what is it? This is where you're working together with your healthcare provider to discuss the risks and benefits of each care option available. And this approach considers your values, your preferences, beliefs, and circumstances. And this is what helps you make informed decisions that are right for you. I said earlier or last webinar, I really want you to think about you are employing your healthcare team. You can choose whether or not this is the right decision or right next step for you. Interview your healthcare professionals. We're going to go through in just a moment how do we unpack that. But just I want you to start thinking that when you are engaging with health professionals, you can choose whether or not you take on that opinion, advice, or next steps or not. And how you do that is, we'll get to that in a moment, but you think about what are your values, what are your preferences, what are your beliefs, circumstances, and this will help you be aligned in what works for you, and it will also help you to make the informed decisions that need to be made. This is really useful when there isn't a clear best option based on evidence or when multiple treatment paths could be taken. We know in the endometriosis and pelvic pain space, the evidence in care that we would like to see very likely will be very difficult to have. So what I mean by that is we want to do some amazing bits of research often that ethics committees, which are the group that really govern research, very likely won't approve because a lot of the things that we're missing in the space of endo is unethical to actually research. So that means that a lot of what we're doing is lacking the quite hardcore evidence that we would really like to see. And that gets really muddy when we're trying to navigate this disease, particularly endometriosis, because also we've had a historic lack of funding. We're going to hopefully see that shift in the coming years, but we don't truly know what this disease that is endometriosis is. We don't truly know, and it's not published and widely accepted. What are the lesions? How do they work in the body? How do they move in the body? There is a thought that there's different types of lesions. So we might have very similar to cancer, endometriosis being this big umbrella term. And as a part of that umbrella, there's different types of endometriosis lesions. And that's why some things like surgery might work really well for some people, and others have no quality of life outcomes or improvements at all. So we're still yet to truly understand what this disease is in the body. And I often say that endometriosis really is where breast cancer or cancer was 20, 30 years ago. Where we have, though, amazing people in this workplace, in this workforce in Australia and worldwide who are really trying to unpack all of that. So information over the coming years will come. But it does mean, though, when we're sitting at the end or the in that doctor's surgery or that health professional's room, they are doing the best that they have with the evidence that they have, which is not a lot, and as are we. So when we're trying to navigate these treatment options and really as what I call throwing spaghetti at the wall and seeing what sticks, being that we are the wall and they're throwing spaghetti at us and hoping that something will work, which is costly, it's timely, and sometimes we just don't have the energy for that, which is also okay. So this is where coming back to how do I make the best decisions? How do I make the right decisions for me, knowing what I have, knowing that this is a really complex space, it's moving quickly. How do we move forward on that? So personalized decision making can help there. So some of the key things that we consider the benefits and the risks. Now, last time in the last webinar, we will refresh it here today. We talked through the BRAINS acronym. We talked through the SBAR acronym. We'll go through that very soon. We want to understand the benefits and the risks. We want to understand the knowledge and understanding of that health professional. This might be, it may be an ultrasound technician, and you might want to know how many pelvic ultrasounds do you do in a year? Or to a gynecologist, how many endometriosis surgeries do you do in a year and what are the outcomes of your patients? You want to check their understanding of these conditions. We know that medical misinformation is out there. We know that our health professionals don't always know the information that we want them to, and often we are educating health professionals on these conditions. And so when you're talking with them, you can suggest things like, can you tell me what you know about endometriosis? Download our brochures. They are evidence-based with updated information, and we are, as soon as we see something shift and change, we are jumping on it to try and update them with the most recent information. So download resources from our website. They're completely free. Print them out, take them in, and ask them, what do you know about endometriosis? What are your perspectives as a health professional when working with someone with endo or pelvic pain? This will give you a sense of, are they going to be multidisciplinary? Do they have a holistic approach? Are they surgically minded? Are they hormonal management minded? Ask them about what they know and what their approach and what they found to be useful. In this process, you're starting to interview them, okay? Thinking about the barriers, these are your barriers and they're health professionals' barriers. So your barriers may be geographically, there may not be really anyone around you that can help. It may be financial. That's absolutely coming up every single day in this space. The cost of living is huge. It may be language barriers. It may be cultural barriers. There may be a mismatch there. For the health professional, it may be barriers to accessing a wider network of people to refer to. It may be a barrier for them in understanding you and your condition or your cultural background. There may be a barrier or consideration around access and affordability, personal preferences, values and circumstances, cultural considerations, the involvement of family and whether or not to involve your family. In some places, that's completely appropriate. In other areas, it's totally taboo. The community connection. Are you connected in with a community? Can the health professional connect you in with a community? Do you want to be connected in with a community? And through this, you're really building two-way trust. You want that health professional to understand you, and you also need to really build trust with that health professional. And you may take a couple of goes to find someone that you trust. That is okay. That is not doctor shopping. That is building your team. Yeah, you are interviewing your team and you are building your team, and you're doing that through this process. So how do we do that? We're looking here, the guide is to explain, talk through what's going on for you, ask for options, look at the priorities, asking for clarification, planning and decision, either making a decision or deferring. Now, ideally, health professionals will be guiding you through this process, but they may not be aware of it, they may have forgotten it, they may not be trained in it. So for you, when you're talking with health professionals, this is a really good map for you to structure your conversations with. So explaining what's going on for you, explaining the symptoms, the history, talking through, here's where I'm at, this is what's led me to be here with you today. Here's the other people in my team. Here's the other people or things that I have tried. These are the options that I would like to discuss with you. I'd like to discuss a referral to X, Y, and Z. I'd like to discuss what you think my options are. Here's what I have shared. Here's what I have learnt. What part of this can you help me with, health professional? Then your priorities. Talking through my priorities are reducing the pain that I'm living in, or being able to go and play sport, or be able to go to social functions, or go to school. Or my priorities are to stop bleeding. My priorities are that I don't want to have kids, so I'd like to talk about what that looks like for me. What are your priorities and what do you want to get out of that session or that engagement with the health professional? Then going to clarify, asking the health professional, would you like clarification on anything that I've just shared? Is there anything in this conversation or anything I've shared with you, something you're not certain about, or is there something in here that you'd like me to unpack further? Or from your perspective, what really stood out to you? When you're asking them these questions, this will give you some sort of insight into what they picked up. That will tell you where their focus is, where they might really prioritize in terms of their next steps. So be curious when you're sharing with them and checking back in, going, okay, I've shared everything with you. What I like to call is a meta report, and I take that from the work of Alison Armstrong, who talks about as individuals, we like to gather information, very much like hunter and gatherers. Back in the berries in the berry farm, we were gathering all the berries and we knew what berries to go to, what berries not to go to, what berries were dangerous, which berries were good. We knew where the good berries were. So think of, shops and sales. We know where the good sales are, don't we? We also know where the good berries are. We know where the good health professionals are and where they're not. You're often sharing that meta report with a health professional. And if you can do that in this structured way, this is how they are trained, and this will help them to work out those next steps whilst also advocating for your options and your priorities. Then you're pausing and you're checking back in. And like I've said, you're clarifying with them what made it appropriate, what stood out for you, what didn't stand out to you. And then from there, you can say, okay, well, let's make a plan. The plan might be to, here's all the options and here's how as that health professional can help you. The plan might be for you to go away and consume the information or discussion that they have shared. The plan might be, like I've said here, to decide or defer. It may be that you can decide right here, right now, but I don't know about you, but I don't make any big decisions without having slept on it, and that's okay too. Even the most significant decisions can give a couple of hours. It can give you you can have a couple of hours to decide, or you might like to defer. Now, if you are deferring, coming back and talking through, okay, what are the risks and the benefits to deferring this decision? What are the risks and benefits to deciding right now? What are my options? What are my alternatives? Okay, if we do defer, let's put a timeline in that. Let's look at 6 months' time or 12 months' time. What are my options then? Again, giving them prompts around what are my next steps here. Ash, we have some questions coming through in the Q&A and I will hold them off till the end unless you would like to chat them now. That's totally fine. Okay. So understanding your values. So how do we pull all this together in practice? First of all, I'd like you to understand what are your values. I don't think we get asked this question. I don't think we ask ourselves this question enough. What are your values? What are your goals? So in your life, in your health decision making, in your health trek, what goals do you have? Like I said, is it to reduce your pain? Is it to have a baby, start a family? Is it to not? Have you decided not to do that? Write down, if you have a piece of paper with you, write down what your goals are. As an action out of this, I want you to really think what your goals are. Is it to stop bleeding? Is it to bleed, but do it in a way that is healthy and pain-free, right? There's no right or wrong answer. I want you to think about what are your goals. Is it to find health professionals that support you? Is it that you want a team around you, that you feel unsupported? Then I want you to think about what do you value? When you are talking with someone, when you are engaging with someone, what fills your bucket? What do you value in a conversation, in a partnership? Is it that someone is there to listen and hold space for you? Is it someone there that needs to validate you? And whilst they need to be knowledgeable, yes, what else do they need? Now, when I was diagnosed with endo 12 years ago, I needed someone to hold space and help me understand my history, and I needed them to hold my hand and sit with me. But fast forward 10 years, 12 years now, I do not need that. I don't value that. I need someone to sit me down and tell me straight, tell me the outcomes, and be really critical with me. But that's because I've done a lot of learning and I've been in this space for so long. I think in probably another 5, 10 years' time, I might need someone to hold space for me again. We don't know. And unless we ask ourselves that question, we won't know. So think about, what do you value? What do you value in that health professional? What do you want to get out of that healthcare team? Do you want them to be able to have a chat with you, or do you want to them to sit you down and tell you straight? It's completely up to you. There's no right or wrong answer. And then what is not a value add? So this might be, again, completely up to you. What is not a value add? So, like I said, for me, someone down and holding my hand and not telling me, more critically, that doesn't add value to me. Or um, not a value of, telling me about the latest research or bits of information is actually not a value add to me when I'm in a situation where I need help right now. Okay. Um, so think about what is not adding value to you. And then your deal breakers. So, what is an absolute deal breaker in terms of that relationship with the health professional? You are wanting to understand your perspective, understand how you're showing up in this relationship. And you do that by knowing, okay, what is an absolutely a no-go? Is it that they are a particular gender or not a particular gender? Is it that the health professional isn't a listener, isn't a learner? Are they not out there learning about the most recent information and being up to date? Is it that they're not open to other alternative options? And I don't like the word alternative, because I feel like alternative options is not alternative. It's totally a part of the plan, a part of the team. Like acupuncture is considered an alternative therapy, but for some people, it's extraordinary. So think about, what are the deal breakers? What what will you really feel and come up against that you just think, I can't work with you? Okay, that's completely okay. Someone said in the comments, what do you do if a GP, I think it was, is not listening to you, or referring you on to someone else or other health professionals? I'll get to that Q&A question at the end, but if that's a deal breaker, if that GP won't sit and listen and talk with you, let's go find another one. That's a deal breaker for a lot of people. Okay, so I would like you to write down those core values and go through what we have here and write them down step by step. Because when we do that, we can get to then looking at identifying some of your symptoms. So we have this as a download on the website. And this is where, if you don't really know where to start, this is a great place too. So this is about me. Okay, so going back to the slide, what are my goals? I want someone to listen to me. What do I value? I value holistic care and collaboration with others. I value support, community, and connection. I want trust in my healthcare team, and I have a need to be able to access services. So popping up the top about you, and on your piece of paper, writing down all of the things that you are looking for in your healthcare team. And when we start to build this out, and I take this as a guiding document to any health professional, either on the app, in my notes document binder, or on my phone. And whenever I'm talking with someone, I'm sitting there and going, right, do you meet my criteria? Do I want to work with you? My energy is precious. My time is precious. My finances are precious. And this is what would be the same for all of you. So when you are working through that and you're sitting there going, right, do you, as this health professional who I'm talking to, align with these things? That means it's going to work with me. You're going to be able to work with me if you align here. I also look up health professionals on social media. I get a bit of a sense of, do they have a good sense of humor? What are they into? What are their interests? Are they actually out there learning? So you can do a little bit of research, not only on their webpage, which is, it's not the full picture of them, but a lot of health professionals will have a business page or a public profile on Instagram or LinkedIn or something. And you want to see, what kind of person are they? Because at the end of the day, they are a person. We're all humans. They show up with their toolbox. They show up with their knowledge. And you, as an individual, interviewing and working out whether or not you bring on that health professional onto your team, this is how you can start to essentially create your criteria. So we're identifying the symptoms here. Right here, we have put down our goals and our values. So how do we build a team? How, who, when, and why? This is what people have told us. This word cloud here is what people have told us. They are walking around in their head. And as you are chatting, as you're reading this, if you can pop in the chat or in the Q&A, which one of these have you experienced, if any of them, or if there's something else that you are walking around in your head. People have told us that pain is just enormous, that this is a hidden illness. They have health professionals dismissing them. They're feeling like all of this is in their head. Sex is painful. They're feeling unsupported at home and in the workplace. People are in agony, but no one sees it, and they are just feeling like they are trying their best. People are wondering if they should freeze their eggs. They're wondering if this is normal. Am I normal? What is normal? We need to throw that word normal in the bin. People can't sleep, but they live with brain fog and they just are exhausted all the time. People are trying to excel in their career whilst managing their conditions. So tell us in the chat or in the Q&A which one applies to you. People are saying yes, all of it. People ask how you are, but they don't really want the truth in their response. Oh, it's so true. People telling us that we're in agony, but no one sees it. People trying to excel. And this is why we don't just need a GP. We don't just need a gynecologist. This is not just a lesion-focused condition. This is a systemic issue in our bodies that needs a team approach. This is why we talk about having a multidisciplinary team. So what tools might be in the team and how can they help and when to engage them? In medical, we have our GP. We have our gynecologist, a urologist, a bowel surgeon, thoracic surgeon, radiologist, and so many more. Now, GPs have more power these days to help diagnose endometriosis if you'd go to someone who is knowledgeable. Now, for GPs, what the shift is that we want to, with new technology and new information, enable them tools to support you in the next steps. Okay, let's unpack that. Endometriosis has historically only been able to see when we have a laparoscopy, when we have the surgery. I don't know about you, but tell me another type of intervention that is required for any other condition that is as invasive as a laparoscopy. That blows my mind that historically, to be diagnosed with endo, we've had to have a significant operation and go under general anesthetic. That needs to change. But in order for things like that to change, we need technology, we need funding, and we need skills, the workforce. And why we are now able to share that there's been a shift in imaging and ultrasound is because of those three things. We have said for years we can't see endometriosis on ultrasound. And for most ultrasound, that's still the case. But what we're seeing most recently is that there's new technology, there's new skills, being that there's a new workforce, and there's new funding going in to advance the technology that we are starting to see through very good scanners. This is not just your general person, not Joe Blow down the road. At identified places, we can see endometriosis on scans. That is with a pelvic health ultrasound that is going for over an hour, that scan, and it's significant and it's in depth. Now, that will start to grow more and more. And what we want to do is be able to give that report back to your GP that has been assessed by an ultrasonographer or someone who's really well trained in this space to go, okay, we saw endo on ultrasound. It's never to rule endometriosis out, but it can rule endometriosis in. So it may not pick up everything, but if they do pick it up, it's a really good piece of information. Then we look at the symptoms and your clinical history, and that GP wants to look at all of those things combined and say, yeah, we have a suspected diagnosis of endometriosis. Okay, let's get you on a chronic disease management plan. Let's get you on a mental health plan to see a psychologist to help manage the load. Let's get you in to see a physio. Let's get you managing these symptoms because we know, as of only, I think, last year or the year before, have known for a long time the amount of disease doesn't equal the amount of symptoms that people are living with. And we know most recently that only just over half of the people that do have surgery do have some sort of symptomatic relief. So, what are we doing with all those people that go for surgery and have no outcomes, no symptomatic relief? That's a lot of people. And so, this is where we can build in this team. We have pain specialists. Pelvic floor physios are extraordinary. We often totally disassociate with our pelvis. It causes us so much pain. Of course, we're going to disassociate with us, but they teach us to map it out. They teach us how to hold our pelvis, how to hold our core, build our core, walk and move and sit. And they're exceptional. So they're going to teach you how to do better poos, do better wees, have better sex. And they can really help you to map everything out. Acupuncture, physio, pharmacy, osteo, and naturopaths can all come into your pain management. To talk about managing the load, we're not saying endo is in our heads. It's a real condition. It's significant. There are lesions in our body causing havoc, but this is a lot to manage. All of those thought bubbles is a lot to manage. We need a support network. So our nurse, our Quendo Care nurse, you can book in them with them straight away. You can chat with Jill straight away. So go to quendocare.org.au. An occupational therapist, a social worker, a support network, individual psychologist, or a counsellor. Movement, again, movement you enjoy, anything you enjoy. I hate walking. I really don't like walking, so I'm not doing that. I want to do movement that builds all those feel-good hormones in our bodies, which helps our pain and nervous system. So I love Pilates. I don't like yoga. Don't like walking. Throw those in the bin, but do things that work for you, and that's totally okay. For nourishment, we know that endo, and particularly endo and pelvic pain, is responsive to inflammatory markers in our body. The more inflammation in our body, the more things just kick off and roll, right? So working with some low inflammatory foods. We're not ever promoting an endo food group. There's lots of discussion at the moment about FODMAP. There's varied opinions. It's a restrictive diet, which we don't want restrictive diets in our life. We want to be open and have lots of different foods that we can have to nourish our gut microbiome. So working with a dietitian and nutritionist or a good naturopath can help with that. And then we have relationships and counselors. So people that help us to discuss and communicate with our friends and our partners. Sex and relationship counselors, when we're in pain, sex is totally off the cards, isn't it? We throw that bit in the bin too. We don't want anyone to touch us. But how do we communicate that? How do we have intimacy in different ways? Or how do we restructure and reframe what intimacy looks like and the expectations of intimacy? And then we want to support a workplace. So this is who could be a part of your team, and it's not an exhaustive list. So how do we bring that in? Okay, we write down our symptoms. So we write down, all right, I had period pain, it started at 10 years old. And you put exclamation marks against what's impacting your quality of life the most. So period pain might, in terms of this, is the most impact that I'm having on my life. Then I feel like I have right side pain near my hip when I'm ovulating. So writing down that symptom. Back pain, bloated belly, and feeling sick after eating pasta or dairy. So write down your symptoms on the left-hand side. Now, when you are going and talking with health professionals, I'd like to remind you of the BRAINS acronym. So when you are advocating for yourself, it may be that you're with a GP, it may be that you're being proposed to go and work with this health professional or try this treatment. Talk through these tools. So B, benefits. What are the benefits to what's being offered right now? What's the benefit of going and talking to that health professional? Or what's the benefit of that treatment? What's the benefit of me trying medicinal cannabis or the new latest medication or physio or psychology? Ask the health professional, what's the benefit to what you're offering me right now? And then what is the risk? There are always benefits and there are always risks. Say, okay, you want me to try this medication. What are the risks that I need to consider here? Or you want me to try medicinal cannabis. Okay, that's a hot topic at the moment. What are the risks here? What do I need to think about? What are the impacts of my family, of my life, or driving? Ask what are those risks. Now, that same question can be applied to any medication. It could just be simply, okay, you're suggesting that I go and try Pilates. What do you know about the benefits of that? They might reference papers, they might reference, different research programs. We've just had the World Congress. There's lots of research coming out of that, which is great. So yeah, asking them, what are the benefits and what are the risks? And then what are the alternatives? There's always an alternative option, always. What else could you propose to me? And that health professional may be completely out of options. Okay, that's okay. You are working and building your toolbox just as they are coming and showing up with the tools that they have access to. That might be a small toolbox of tools, or it might be a huge toolbox of tools. The questions that you asked earlier can help you understand how well connected they are, how much knowledge that they have in this space, and whether or not you are gaining trust in talking with them. So A is the alternatives. What alternative options do I have to this? Going back to the decision-making tool, can I defer this? Do I have to decide now or can I defer this? I is your instinct. Like I said earlier, we disassociate with our bodies, particularly in this space. Come back. What is it? What is our bodies telling us? Do we feel a knot in our stomach? Do we feel completely numb? Have we just become completely flooded and overwhelmed? And I can also be for the intention. What's the intention behind this medication? What's the intention that you're suggesting behind this different treatment option or surgery or not surgery? So asking the I could be instinct or it could be intention. N is for what if you do nothing? What if nothing happens? What if you do absolutely nothing? There are benefits and there are risks to doing nothing. That's perfectly a good question, but that allows open conversation around that. And S is for support or second opinion. It is not doctor shopping. You are through this process going through a structure to interview health professionals to make decisions that align with your values, align with your goals, and meet a lot of those different symptoms that you are trying to improve, like we saw earlier. And the second tool is SBAR. This is where you can talk with a GP or emergency if something's new happening to you right now, or someone doesn't know about your condition and you're telling them for the very first time. So the situation, describe what's happening right now, be specific and voice your concerns and explain your treatments. B is for background, give a history of your health background and any complications or major concerns that you're experiencing. A is for assessment, describing the red flags that you have seen, your signs and symptoms, what is making it better and what is making it worse. What have you tried out of your toolbox? Here's the things I've tried. This is what's not working and this is what helped. And then R is recommendation. So offer your recommendation on what you think would be beneficial to do or test, and what would you like that health professional to do? Is it a referral, a scan, a blood test? What does that look like? And here at Qendo, we have this ecosystem of services and supports here available for you. So you can help build your community and your toolbox. You can access our helpline. You can access our mentoring. You can access our app. And you can also speak with Jill, our nurse, through qendocare.org.au, and also manage online education through the Manage Endo course. Right here, you will see some poll things pop up on your screen, and I really encourage you, if you can, just to share a little bit of your comments and thoughts about this webinar. So if you can please pop in those 3 questions, that would be really, really useful and helpful for us. If you haven't downloaded the tracking app, this is where you can start to learn and track what's going on for you and take that to health professionals as a tool, as a resource to go, here, this is what's going on for me. Help me step through that. It gives data. That means that, yes, we have this structure of how we want to communicate what's going on for us, but sometimes you need to back it up with data. In research, that's what we call the qualitative, the language, and the quantitative, the data. We want to go to health professionals with both of that information to share and show that full picture. We only have 15 minutes often to talk with health professionals. That will help bring it together. If you need support right now, we can connect you with a mentor and scan the QR code here for a mentor or a mentee, and we'll connect you with someone over a 6-week program that gives you that space to digest and debrief and chat. And care is here. We have no cure for endo or pelvic pain, but we do have care in the meantime. So you can speak with us to debrief after appointments or a diagnosis, guidance to navigate complex care pathways, where to next for you, support for partners and parents involved in your healthcare, and you can also be referred into other programs and services. So the next steps, again, if you can please pop in the poll, that would be wonderful so we can understand what's going on for you, and if you found this helpful, it will also help us to show funders that it was useful, because we always want to make sure that whatever we're sharing is of use to you all. We will have this recorded and popped up online, and we will get prepared for the webinar, final webinar 3, where I'm going to be talking through very specifics on creating a care plan for you and how to navigate that. So there's a lot of scripting, a lot of dot points, a lot of tools that you can print off and take for you. And yes, it will be so action-packed, get you working, get you considering, and get you prepared for your next interaction with the healthcare system. That is on Thursday evening at 6:30, and we would really love to see you there. So we have a couple of minutes for questions. And again, if you can please pop your responses in the poll, that would be really useful. Ash, over to you for some questions.
Awesome. Our first question was earlier on in the session today in relation to how do you navigate around a GP that doesn't necessarily want to guide you in other forms of other professionals?
So when I talk with a GP who is experiencing that, think about that the size of their toolbox, okay? They might have a little toolbox that they don't really know, it's not their area of expertise. This is where you can show up as a partner in that relationship. It is a relationship, maybe a 15-minute relationship, but you can go in and advocate for what you need based on the questions that we have asked here. So go in with, I need this, or these are some of the things that I would like to seek assistance with or help with. If they aren't that great in helping you refer for the next steps and they're resistant, even though you have gone in and gone in with confidence and a bit of agency and a bit of, okay, this is where I want to head next after you've considered it. A lot of times we've never thought about these questions. That's okay. I didn't think about it when I first started. Then it might be time to get a different GP. That's okay. Yeah. Get a copy of all of your papers and comments and patient notes and all of the different bits and pieces. Ask them to send a copy to you and find a different GP and go and interview. There are wonderful GPs out there. There are truly incredible GPs out there who blow me away. We speak to hundreds of GPs, thousands of GPs every year at this stage. There are some truly amazing ones out there. But we also know there are ones who have really got no idea. And they are general practitioners. They are general. They don't have a special interest in this space. So after doing this session, trying some of these tools and trying some of these suggestions, if you're still not finding traction with them, let's go find another one that will partner with you along this this trek. Let's call it a trek. Really good question. It's one we find a lot. Ash?
One tip you could take to your GP when you are having a flare and they don't listen to you?
That's a good question, because also flares are not that well considered, are they? A flare, going to them and saying, I am having an acute flare. So acute means temporary, chronic means long term, more than 3 months. I am having an acute flare of a chronic condition. It's a lot to wrap your head around. It was a lot for me to wrap my head around. If you were going with a GP, you could go with them and say, I am having a flare right now. These are the things that I have tried. These are the things that worked or helped or didn't help. Do you have any other suggestions for me? So going and asking them very active questions. Is there anything that you could think about that I haven't tried? And what would you suggest that I do? And also asking to follow up. Now, it may be that you're on a wait list for outpatients or hospital appointment. So it may be that GP writing to your referrers or the public hospital to say, this person has come in with another flare again. Can you please review the referral? What's the ask? Think about what the ask is and do that outside of a flare. So do it when you're not flaring, because when we're flaring, our brain fog is intense and we are tired and we honestly just need help. But think about the fact that we're in a flare, an acute, so a short increase or a short increase in symptom or worsening of symptoms, and an acute, so a short-term increase in symptoms from a chronic condition that we are living with. Yeah. And it's hard. So if you can't go in with, with some sort of idea of what has worked and what hasn't in your toolbox, then they're also going to struggle because they're not across it as much. And in the GP's room, they can't do a lot either. Other than prescribe medication or look at that. So I would be saying to them, who else can you point me in the direction to? But this is honestly in a flare situation where a pelvic health physio comes in, they're going to teach you to map and process and hold the body in a way that will be really helpful with flares. Motion is lotion as well. Thanks, Ash.
That is all the questions we have today.
Wonderful. Okay, well, thank you all so much for your time. It's been a pleasure to talk with you, and thank you all for the contributions that you have shared with me when chatting here today. So please join us on Thursday evening for the final webinar where we'll pull it all together. We'll create a personalized navigation plan for you, and that will enable you to take that away with you to start guiding your next steps in navigating the healthcare system. Have a wonderful day. I hope it is a pain-free, flare-free day for you all. And if you do ever need help, please connect with us. You can use those QR codes here, and all of our services are free and they're available to you regardless of your postcode. Thanks again so much, and we'll talk with you soon.